Hi, we're back, and we're going to be discussing the osteology and palpable anatomy of the upper limb. So to start off, let's review what we saw last time on the shoulder blade, or the scapula. We've got the spine of the scapula, or scapular spine right here. It comes around to a lateral point that's called the acromion. If we roll down onto the humerus, one thing we're going to see right here is the greater tubercle. There is a lesser tubercle just medial to that, but the one that we can palpate most readily is the greater tubercle right out here. Let's take a look at that on a person. All right, and we're back with Ashley. From here, we're going to turn sideways. There we go. And see, we have once again the spine of the scapula going horizontally across to the point right here. That's the acromion. Go ahead and face the camera. And right down here, if you come off the acromion and down, the next bone you're going to palpate is the humerus. Now, the greater
tubercle
is in there. It takes a little bit of digging. It can be a little bit painful, so be a little gentle with your partners. Don't use your fingernails, just kind of work in here. Between the greater and the lesser
tubercles
is the tendon of the long head of the biceps, which comes all the way down the anterior part of the arm. With your partner, you can sometimes palpate that. So at the direction of clinical skills or OPB, this is the area you're looking for the greater
tubercle.
And just medial to that, the long head of the biceps. The muscle that's located just lateral to the shoulder, makes up most of the shoulder itself, is called the deltoid. It comes off the spine of the scapula, the acromion, and the clavicle here in front, and covers the lateral aspect of the shoulder. As we move down the arm, go ahead and just turn this way. Oh, sorry, face the camera still. The little pit in the elbow right here is called the cubital fossa, and go ahead and face that direction. And on the outside, posteriorly, we have the tricep muscles back here, and they're inserting on a bony prominence of the ulna called the olecranon. Go ahead and flex your arm. So right there, that process is the olecranon. Point of the elbow right there. All right, taking a look at this on the skeleton, we'll pick back up where we left a moment ago. The bend of the elbow right here, the bony protuberance that we see posteriorly is called the olecranon, and that's part of the ulna, one of the forearm bones. We turn this here, we can see the humerus has a medial and a lateral epicondyle. These are the flare-outs that happen here, and they're serving as sites of muscle attachment. The lateral epicondyle is where we have the extensors originate. So from the lateral epicondyle, the forearm extensors are heading down this way. From the medial epicondyle, the forearm flexors are heading down this way. As we go down to the end of the forearm, we're going to see here, the end of the ulna, the end of the radius. There's a little bump on each side that's actually palpable. That's called the styloid process. So you have a radial styloid and an ulnar styloid. Now, one quick thing to note, the radial styloid is lateral and the ulnar styloid is medial. But if I do this, suddenly it looks reversed. Because it's so easy to get confused between which side is facing forward, anatomic position is always described as palm facing out. That's why this is the lateral or radial styloid, and this is the medial or ulnar styloid. If that's at all confusing, watch it again because you do want to get that down. Moving from the styloids to the wrist, we have this collection of small bones here. These are the carpal bones. And really the most prominent one of those that we can palpate is the most medial proximal one. That is the pisiform bone sitting right here. So let's take a look at that in real life. Last time we started with the olecranon on the posterior aspect right here, the turn of the elbow. Go ahead and face the camera. So the humerus has the lateral and medial epicondyles. And those are both easily palpable right here. Medial epicondyle is where the flexor muscles originate. So as she makes a fist, those are the flexor muscles working right there. And from the lateral epicondyle across the back are the extensors, pushing and flowing the fingers out that way. Thank you very much. As we travel further down, there are some palpable landmarks up here, but we're going to focus on the styloids, the end of the radius, thumb side, and the end of the ulna, pinky side. Now right here, you can palpate the radial stylus fairly easily. The ulnar styloid process is a little more proximal, and you have to dig a little bit to feel that. What you can confuse that with is that large, prominent carpal bone that's located just in front of it. That is the pisiform. So if it's large and easily palpable, it's probably the pisiform bone on the pinky side. The muscle that attaches just just distal to that is known as the hypothenar eminence. And likewise, on the thumb side, the pad of the thumb right here, these muscles are known as the thenar eminence. And when we get to anatomy, we'll go through every little one of those, but right now, just worry about thenar, hypothenar eminence, flexor muscles, extensor muscles, flexors of the forearm like the biceps, and extensions of the arm like the triceps. Deltoid, and we're good to go.